Welcome back to News Across Nigeria. Now, the help the Yobe State government is seeking is in the way of humanitarian assistance from international organizations as well as non-governmental organizations for locals who are returning to their ancestral homes after years of violence. The governor made the appeal when he received the Canadian High Commissioner to Nigeria, Mr. Perry Calderwood, in Damaturu, the state capital.
With peace gradually returning to the northeast, life appears to be normalizing in communities liberated from Boko Haram insurgents. The prolonged insurgency has affected the economy of families, with many living in abject poverty. With the deepening of humanitarian crisis, states like Yobe have no option but to appeal to her visitors. The Canadian High Commissioner to Nigeria and his team, including other international partners, to come to the rescue in alleviating the sufferings of her people.
May I therefore appeal to the High Commissioner to talk to and mobilize other international partners and non-governmental organizations for urgent intervention in providing food and essential non-food items, support to agricultural activities, provision of building materials, and cash support to the victims of insurgency in the state. I would like to call on the Canadian government to further support the state to rehabilitate and reconstruct basic infrastructure like water supply systems, schools, health facilities, administrative buildings, market stores, and rural electricity installations, among others.
Commending the efforts of state government in returning peace in the troubled northeast region, the Canadian High Commissioner to Nigeria, Mr. Perry Calderwood, promises that his country will always be there for the internally displaced persons in the region.
The purpose of my visit is to learn firsthand about the situation here so that I can inform my government about the serious needs, and I hope that in future years Canada will continue to support people in need as Yobe State and the other states of the Northeast recover from the damage of the insurgency. I'm very happy that Canada is providing funding, about $6 million US, through humanitarian agencies such as UNICEF and Action Against Hunger to help them deliver basic services to people in need.
Presently, there is a twin partnership being supported by Canada, UNICEF and Action Against Hunger, working seriously towards tackling water problem and educational backwardness, among others, in various communities across Yobe State.
Now let's get up to speed with what's happening with the health sector across the country. Members of the Joint Health Workers Union at the Federal Medical Center, Abeokuta, the Ogun State capital, are drawing attention of the public to the alleged infrastructure decay at the facility, which they say has continued to hamper effective healthcare delivery in the institution. The members who suspended their services for the time the protest has lasted, said the institution lacks basic equipment to meet the ever-increasing number of patients who seek medical attention at the hospital. They're asking the federal government to quickly intervene before the situation gets out of hand. Efforts to get the reaction of the management on this development proved abortive, as the chief medical director was said to have retired a while ago.
The challenges of FMC Abeokuta at the present moment is the challenges of leadership. We have bad leadership who has governed us in the last 8 years to, rather than upgrading the state of art of the institution, has degraded every aspect of care in this hospital. Do you want to talk about lack of facilities? We lack facilities in this hospital to carry out basic tests and investigations for our patients that access care in FMC Abeokuta.
Meanwhile, the Federal Ministry of Health has been speaking on the alleged sack of striking resident doctors. According to the registrar of the National Postgraduate Medical College, Professor Oluwole Toyebi, the federal government has not sacked the striking doctors, and that both parties have agreed to resume talks in 3 weeks to resolve all outstanding issues.
Both the resident doctors and the Ministry of Health, under the leadership of the Minister, Professor Isaac Adewale, agreed that we allow peace to reign so that in 3 weeks' time, on the 14th of July, when we meet again, we can resolve all outstanding issues. So no doctor has been sacked. Actually, the directive that went out from the ministry was that the ministry was being preemptive to ensure that there is no lacuna, that if the strike was going to be protracted and be as long as it was in 2014 for almost 2 months, then the ongoing recruitment of resident doctors should take place quickly so that some people will be available to train and to offer services. And mind you, Ministry of Health cannot really sack the resident doctors. All the resident doctors from our own time, over 30 years ago, were employed, all the resident doctors were employed by the management boards of the different teaching hospitals. So it's the management board that can actually execute a sack, not the Ministry of Health.
Staying with the health sector, and this time to the southeastern part of the country, prevention and compatible genotype matching remains the best method for reducing sickle cell disease. This awareness is being spread across Abia State by the wife of the state governor, Mrs. Nkechi Ikpeazu. Mrs. Ikpeazu is worried over the increasing number of children affected by the disease, which, according to her, can be prevented if parents do the needful. And now to economic matters and the South-South. The governor of Akwa Ibom State, Udom Emmanuel, has described the 90 billion naira budget support loan from the federal government to the states as a lifeline in view of the current economic challenges. The governor made the remark while speaking to journalists in Uyo, the state capital. He said this move will help states to fund their development programs.
This is called the Budget Support Facility. And why is the federal government making the states to access this? It's simple. We are saying there's a reconciliation that is ongoing between the state government and the federal government. Some state governments are being owed a lot of money that they spent on federal roads and other federal assets. Also, there's an issue of Paris Club and so many other captions that have been raised by the state government. And what the federal government is doing, as the reconciliation is ongoing, they are providing like a lifeline. We all presented a budget. We are expected to show a certain level of implementation of the budget at the end of the year. And if this is June, we've not gone so much into the budget. At the end of the day, democracy is about impacting the lives of the people. And you can only do that through a normal appropriation act that you have. So what the federal government is doing is telling us, look, we have a line. You can draw this line to implement your budget pending when we finish all the reconciliations, and then what is due to or from can easily be established.
Mr. Udom Emmanuel, Governor of Akwa Ibom State. Meanwhile, the Ogun State government is also set to tap into the federal government's 90 billion naira loan opportunity as the State House of Assembly has approved Governor Ibikile Amosun's request to obtain 14.16 billion naira from that support facility. The facility, which spans through a 10-year period with a single-digit interest rate, would reduce the financial burden of the state as well as stimulate economic growth. The state lawmakers frowned at the steady attacks on gas pipelines by the Niger Delta Avengers as it has taken a toll on the nation's ailing economy, which had depleted the revenue accruable from the sale of crude oil. You're watching news across Nigeria. Coming up, a commissioner in Lagos State for transport, that is, speaks on the issue of flooding in the metropolis. Don't go away.